Good morning. I'm Dr. Mary Stephen. Welcome to the WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. First, some housekeeping. You can listen to the press conference in either English or French. To do that, please go to the bottom right-hand corner of your screen, click the globe icon and select your most preferred language. Vincent, can you please explain to our French journalists?
Oui, bonjour et bienvenue à la conférence de presse de l'OMS Afrique. Vous pouvez suivre cette conférence en français en cliquant sur le globe en bas à droite de votre écran, le globe interprétation, et en choisissant français. Over to you.
Merci beaucoup, Vincent. And now joining us from Brazzaville is Dr. Mashidisho Moeti, the WHO Regional Director for Africa. And Dr. Moeti will introduce our remaining panelists. Good morning and welcome, Dr. Moeti.
Thank you very much, Mary. Good morning, good afternoon, bonjour, and welcome to all the journalists joining this press conference. Today, we'll discuss the latest trends in COVID-19 cases and vaccination in the African region, and also provide an update on the monkeypox situation as it pertains to countries on the continent. I'm really pleased to be joined for this important conversation by Dr. Daniel Kiabayinze, the Director of Public Health in Uganda's Ministry of Health, who will discuss his country's COVID-19 vaccine rollout to the most at-risk groups, which quickly increased the number of people reached since the beginning of the year. We're also joined by Professor Emmanuel Nakune Yandoko, the Director of the Laboratory for Arboviruses, Viral Hemorrhagic Fevers, Emerging Viruses, and Zoonosis at the Institut Pasteur in the Central African Republic, and Dr. Peter Fonjungo, the US Centers for Disease Control's Country Director in the Democratic Republic of the Congo. A very warm welcome to all my fellow panelists. So Professor Nakunde Yandoko and Dr. Fonjungo will provide an update on monkeypox vaccine research and what it means for Africa. Africa's reported COVID-19 cases have now reached just under 12 million, and about 244,400 lives have been lost. We observed a marginal increase in the number of new cases last week, following a sustained 3-week decline. This could well be a reflection of the easing of public health measures across countries, or possibly in some of the northern countries, people traveling more. However, at this stage, weekly incidence remains relatively low compared to previous waves of the pandemic. I'm also pleased to be able to share some promising results from the concerted efforts of African countries to urgently step up COVID-19 vaccination coverage among their most at-risk people. Indeed, the first 5 months of 2022 have seen significant increases in vaccination rates for these groups in 31 African countries. For example, nearly half of all healthcare workers and people aged over 60 years are now fully vaccinated in these countries. While that is still far short of the WHO recommendation of 90% vaccination coverage for health workers and 80% for the over 60s and those who are at highest risk, it's a notable improvement on where these countries were at the end of 2021. You may recall that at that time, only 33% of health workers and 10% of older people over 60 years of age were fully vaccinated, living at considerable risk of contracting COVID-19, but also for severe illness and death. I'd like to acknowledge what can only be described as an impressive turnaround. Following a year beset with poor access to doses, costly delays, and shortfalls in 2021, African governments have done well on the whole to maximize this year's increased vaccine availability to protect their populations. But I do want to encourage them to keep up and even accelerate the pace. I know that as many as 31 countries have planned mass vaccination campaigns for the second half of 2022, and we look forward to further improvements going forward. WHO is also collaborating with partners to deliver multi-partner country support to 14 African countries with COVID-19 vaccination coverage lower than 10%. If these countries are at risk, we are all at risk. So we need to do everything possible to ensure they don't fall further behind. We're also helping to strengthen their management of COVID-19 vaccination data. This is no small task, given that many of these countries are also grappling with humanitarian crises or other disease outbreaks. Turning now to monkeypox, I can confirm that there are now a total of 1,900 confirmed cases in 39 countries across the globe, including 8 African countries. Of those countries in Africa, monkeypox cases have been previously reported in 6. There have been 36 confirmed cases in Nigeria, 10 in the Democratic Republic of the Congo, 8 in the Central African Republic, 3 each in Benin and Cameroon, and 2 in the Republic of the Congo. Ghana and Morocco, which have not previously recorded cases of monkeypox, now have 5 and 1 confirmed cases, respectively. Additionally, Ethiopia, Guinea, Liberia, Mozambique, Sierra Leone, Sudan, and Uganda, all countries with no previous incidents, have also reported suspected cases. This is clearly an unusual situation that is affecting more and more countries. So soon after the inequities Africa experienced in respect to the COVID-19 response, we recognize, of course, that we cannot afford any potential repeat and need to be adequately prepared. So WHO is convening an emergency committee on monkeypox next Thursday, the 23rd of June, to assess whether this outbreak represents a public health emergency of international concern. However, as WHO in Africa, we're already ramping up support to countries to urgently increase testing capacity for monkeypox, and we're in the process of procuring thousands of tests for the continent. As far as the vaccine is concerned, one of the newer and safer smallpox vaccines has been approved for the prevention of monkeypox. Although we're certainly not recommending mass vaccination at this stage, we must ensure that we are ready should the need arise. Global stocks are extremely limited at this stage, but we're working closely with member states and partners on a coordination mechanism to ensure fair access to both vaccines and treatment. Finally, I'd like to share some views on a momentum to rethink pandemic preparedness on the continent. This is critical given what we are living through with COVID-19, and I welcome discussions on a way to protect African lives against pandemics. 54 African member states are actively contributing to the global architecture on pandemic preparedness and response. Given increasing global interconnectivity, which we've seen with COVID-19, this negotiation will determine how Africa will be protected from outbreaks arising elsewhere and how to manage health emergencies originating on the continent. As we know, viruses do not have borders. I welcome the ongoing discussion on a continental pandemic declaration mechanism. It's important to assess the benefits and the risks. An African pandemic treaty aims to make us less dependent on others, but it could also trigger more travel and trade restrictions, isolating Africa, as we've seen, for example, with the Omicron variant. A significant number of African member states believe it's in the interest of all countries that more consultations, reflection, and analysis take place before any final decision is made on this matter. And WHO welcomes the opportunity for this discussion. As we are part of one world, we should also look at what other continents are doing and note that for the moment, perhaps we are leading in this thinking about declaring a continental outbreak. We urge a collaborative and reflective process for determining how public health emergencies are declared, and we welcome consultation and discussion on this. It's important to find the right balance between reacting quickly and building a system that will stand the test of time. So I thank you very much for joining us, and I look forward very much to our discussions today. Thank you.
Thank you very much, Dr. Moeti, for that update. And to you, Dr. Daniel, Uganda has made remarkable progress with its COVID vaccination coverage in the first 6 months of 2022. Please tell us about the techniques you utilize to speed up the country's immunization program, as well as the problems you faced and how you overcame them. What do you have in plan for the next 6 months of the year? Welcome, Dr. Daniel.
Thank you, Dr. Mary, and thank you, Director Baweti, for having us. And this is a good opportunity for us to cross-learn from the rest of our colleagues in African region. Uganda started its vaccination campaign in March 2021, but without much success because we had very limited vaccines. But having utilized these vaccines at a very slow pace, we changed tactic to move away from vaccinating at static sites in the health facilities, and we opted to go for an accelerated mass campaign within the whole country, going region by region. And this was supported mainly because in the main city, we decided to take the vaccination to the stadium. And the turnout of people who came to get the vaccines at the end of November showed that the country was now ripe to get the massive vaccination. With the President of the Republic of Uganda, Yoweri Museveni, coming to the home and showing publicly that he's taking his vaccines, I think that helped us to move to where we are currently. And quickly, we got a lot of vaccine donations and supplies and support from all our donors and well-wishers and COVAX facility. We received over 30 million vaccine doses by then. As we speak now, Uganda has cumulatively been able to vaccinate 21.6 million doses, and we have 70% of the target group. We have so far vaccinated 74% of the people above 18 years, and we have 51% of the people above that age group vaccinated. The key story is that we had our priority groups right. It was a slow start, but as we speak now, we have over 135% of the health workers vaccinated, at least receiving their first dose, and 89% receiving full vaccination. To that, because we needed also to open the schools, we have 98% of the teachers vaccinated, and critical to the resurgency and prevention of death, we have almost 87% of the elderly people vaccinated. We take this to be significant progress. How did we able to achieve that? Is because we moved from region to region, sensitized everybody, and we had buy-in from the leadership. So as we speak now, we have done 2 successful nationwide campaigns, moving from regions, which are organizations of about 12 to 15 districts. We go into the region, we do a massive launch, and invite people to come to open places where they are comfortable away from their health facilities. We've seen social media and also common media platforms helping us to improve this. So our key successes are 3 points: good leadership and being able to be identified as people who are championing vaccination, availability and increase of vaccination, and support in the technical rollout. We also used other technical groups like the vaccine acquisition and also the NITAG and the strategic committee advising. Just to make it sure that has not all been roses, we did get a lot of challenges, especially from the people championing anti-vaccination and also sharing very degradative and preventive measures. We've just gone on to engage with them, use champions to speak back to them, but we've also put them on national platform so that they can explain their notions. We think going forward, we are planning a 3rd wave, and in this 3rd wave, we are adjusting our vaccination. We're now going to include people above 12 years as a starter. We've already vaccinated almost 300 children above 12 years, especially those who had comorbidities or parents who preferred. So we thank our donors, we thank our support team for helping us. Thank you, Mary, and I'll be happy to give any further details.
Thank you very much, Dr. Daniel. And now turning to you, Professor Emmanuel, could you tell us about the monkeypox vaccine and its use in Africa? Professor Emmanuel, are you there?
Yes, thank you, Dr. Moiti. Thank you, Dr. Mary, for the invitation. It's my pleasure. I will speak in French to feel comfortable.
Yes,
So
go ahead.
let's switch to French. Je vais donc parler très rapidement du traitement du monkeypox en République centrafricaine et l'intérêt d'associer la vaccination afin de limiter la propagation. Pour une fois que nous sommes confrontés à des épidémies de maladies largement négligées, nous avons des options pour traiter et prévenir la variole du singe. Nous avons donc utilisé le tecovirimat, qui est un antiviral, qui a été enregistré en juillet 2018 aux États-Unis et en janvier 2022 en Europe. C'est un antiviral qui inhibe la réplication du virus et les effets cytopathiques induits par le virus en empêchant la sortie de ces particules virales, ralentissant ainsi l'infection pour permettre au système immunitaire inné d'éliminer le virus. Donc, dans le but de bénéficier la population la plus touchée par cette maladie, de ces avancées médicales, nous avons commencé à analyser les résultats des traitements que nous avons eu à administrer chez des personnes atteintes de la variole du singe en République centrafricaine dans le cadre d'un accord tripartite entre le ministère de la Santé, l'Institut Pasteur de Bangui et l'Université d'Oxford qui a agi en tant que sponsor. Le médicament a été donné par la firme SIGA qui a également fourni un soutien financier modeste à l'Institut Pasteur de Bangui pour l'aider à couvrir les coûts de déploiement du vaccin. Donc, il s'agit de la toute première série de patients traités par la même intervention selon le même protocole, ce qui devrait apporter une contribution importante à la documentation de l'efficacité et de la sécurité clinique de cette intervention et idéalement ouvrir la voie à son utilisation à plus large dans les régions endémiques les plus touchées. Comme nous voyons aujourd'hui en Occident, dès qu'un cas est rapporté, les contacts sont systématiquement vaccinés. Nous savons qu'en Afrique, la principale voie de transmission une fois le cas index à partir du réservoir est la transmission interhumaine à travers les vésicules. Donc, il est très important d'associer à ce traitement une vaccination. Et nous avons vu l'exemple d'une étude qui a été menée en RDC, en République démocratique du Congo, par l'équipe de Peterson, qui ont utilisé un vaccin de 3e génération qui est l'umvamine, qui donc est un vaccin modifié dont les effets secondaires sont moindres par rapport aux 2 premières générations, la première et deuxième génération de vaccination. Donc, nous pensons qu'ils sont en train d'analyser les résultats de cette étude et nous pensons que si en Afrique, nous arrivons à associer des vaccinations autour des cas confirmés, nous pouvons limiter la propagation du virus, ce qui donnera l'occasion de contrôler cette maladie et de pouvoir éviter les mortalités qui, selon certaines études aujourd'hui, tournent autour de 10%. Voilà ce que je peux dire et je laisse le temps aux questions pour nous permettre de rentrer en détail.
Merci beaucoup, Professor Emmanuel. And now I turn to you, Dr. Peter. Could you please tell us about monkeypox vaccine research in Africa and the implications for the continent? Dr. Peter, over to you.
Thank you, Mary, and thank you, Dr. Mweti. Honored to be part of this panel. And for that question, Mary, I'll be confining my remarks to DRC. More recently, the Ministry of Health and the Kinshasa School of Public Health and the U.S. Centers for Disease Control and Prevention conducted a study in DRC on the use of the Jynneos vaccine to prevent monkeypox. I think this is the vaccine Dr. Moeti was alluding to in her remarks, in individuals with a documented high risk of infection, and these were healthcare workers. The study began in 2017. The study had 3 objectives: to evaluate the safety of the vaccine, to evaluate the immunogenicity of the vaccine, and then to evaluate the effectiveness of the vaccine to prevent human monkeypox. At the end of the study, there were no vaccine-associated severe adverse events reported. One participant was infected with monkeypox virus infection after caring for a monkeypox patient. This participant's infection was not severe and they recovered. And serology studies showed that participant mounted immune response after receipt of the second dose of the vaccine. There is also an additional study beginning later this year, which will explore the persistence of immunity. This study will involve administering a single dose of the vaccine to a cohort of up to 300 previously studied participants, 3 years and above, following primary vaccination with the vaccine. Participants will include male and female healthcare workers above 18 years old who received the primary vaccination as a participant in the previous study, the one I just alluded to earlier. Participants will be followed approximately 3 weeks. This study is one example of taking the smallpox research agenda and putting it to good use. However, more studies are needed. Vaccines is just one critical step. Treatment and others are another, just as we heard from Professor Emmanuel. I think this is just one tool, and I think the continent, in terms of like implication, the studies, the results are still being analyzed, and once we have that and approved, we have approved vaccine. I think the continent has just one tool in its armory to fight to find this disease, and also just in terms of like having access to these vaccines. That's something that to also build that capacity for the continent to be producing their own vaccines, so that we don't find ourselves a similar situation we had with access to COVID vaccines as well as diagnostics. So I think there's that need to also capacitate the continent in terms of like producing these vaccines so that it can be made available to the population at risk for this. So I will end my remarks here, and we'll be happy to expand and take questions. Over to you, Mary.
Thank you very much, Dr. Peter, for giving us update on efforts concerning monkeypox vaccination research. And now that you have heard from all our panelists, dear journalists, it is your time to ask your questions. To do this, please use the Q&A function on the Zoom platform. Give us your name, the name of the media organization you represent. If you like to go live, also indicate in the Q&A function, and you could also raise your hand. So we also have additional experts on ground to answer your questions. Dr. Salam Gi, this is the the regional emergency director for the continent. And we have Dr. Fiona Braka, the team lead for emergency response, Dr. Fiona Aturibe, immunization officer, and Dr. Tiano Balde, the regional COVID-19 incident manager. I will first of all start with Paul. Are you ready to go live with your question? Paul from the Lancet.
Yes, thank you very much. So my first question goes to Dr. Moeti, and it has to do with the WHO's global plan to introduce a monkeypox, so-called a vaccine sharing mechanism. What are your thoughts on this? And how do we ensure that, because the rest of the world that has more money to buy these vaccines is still disenfranchised African countries where the disease has been a top priority for a while? So what are your thoughts on this? And regarding the proposed plan for Africa to be able to declare its own public emergency, how much disruption will this bring to how emergencies are declared, particularly considering the local perspective, the different pandemic priorities for African countries. For the researchers, monkeypox research has been proud to this year that it is getting much attention. So I'd like to know what they think the impact of this global attention to monkeypox would be for monkeypox research in general. Thank you very much.
Thank you, Paul. Dr. Moeti, and then Dr. Salam, please get ready to provide additional response.
I'm sorry, Mary, I couldn't hear the first question clearly. Could he please repeat the first question?
Yes. Paul, your first question, please.
Yes, so for my first question, I want to know the WHO Africa regional position on the proposed plan by WHO Global to introduce a mechanism for sharing smallpox vaccines, and whether this would not lead to African countries being disenfranchised from having easy access, considering richer countries may have more money to secure more doses, thereby replaying what happened with the COVID-19 vaccine.
Thank you very much. I mean, first of all, I think that given the fact that there have been over the years cases in Africa, in endemic countries, and now we have seen this outbreak that's happening in other countries, I believe that probably the fairest approach is to consider a plan that will equitably, I'm certain, enable countries to have access to vaccines. I believe that the experience that we have had over COVID-19, where countries in different regions, parts of the world were in need of a vaccine, will be very instrumental, will be very informative for whatever mechanism is being put in place now. And I do think that considering that we have this phenomenon of monkeypox, which, by the way, I understand there's going to be a discussion about renaming, spreading in many more countries than it had already initially been seen. I believe it is a collective approach, and an approach to share the vaccines is probably the fairest way to go and the most effective way to go to ensure that different countries in different regions, either those who are endemic or where we're seeing this outbreak happen, have access to vaccines. I think your question on the declaration of a continental public health event was, would this be a distraction to the process of responding? I mean, you know, we see in Africa, for example, in any year, over 100 public health events of different sizes and different severity. And it is always useful when this is declared, of course, and very often this is declared by the government to WHO based on what they are seeing as a trend or data, the data that's arising, and then there is work organized to contain that outbreak. So what we have understood from some of the questions that have been raised by some ministers of health asking WHO to understand better what is proposed was really what would be the advantages of such a declaration at the continental level, and what could be some of the disadvantages of such a declaration at the continental level. So these are the questions that are being studied at the moment. Certainly the ministers of health who are in the process of making various decisions are seeking to understand better some of these pros and cons of declaration of outbreaks at different levels. We would recommend that any decision made after this analysis lend itself to a rapid response, mobilization of resources, but also ensure that such declarations don't then result in the type of isolation that we have seen in the past happen when countries are revealing information about outbreaks. So the connection to the global reflection on the global level is also very important. So we believe these are matters that need further reflection, and we're very interested in supporting our member states and our partners to think through such processes. And then the third question was on, sorry. Sorry, I didn't take note of the third question. If you could please repeat that.
Paul, are you there?
Yes, yes. So my third question is for the African monkeypox researcher. So I wanted to know the impact that the current global attention on monkeypox has been on monkeypox research generally, especially on the African continent, considering this is not the first year that we've been conducting research. So how much difference will global attention be?
Yes, I mean, I think that there is additional attention being paid. And as I said in my remarks, we're seeing reported cases in a couple of African countries that have not had cases before. So clearly this is a phenomenon that needs to be understood over and above the endemic countries where cases have been seen before. And I believe it can only be beneficial to the whole world's understanding, preparedness, investment in tools, investment in prevention, and the response that there is this attention to monkeypox at the global level, including very much then benefit to African countries, including those where this disease has been endemic. What this requires is really the principles of sharing, of solidarity, of equity, and ensuring that what is invested by those that have the means to invest is shared among countries where this disease has been endemic and other countries that are newly finding themselves with cases. We've learned a lot, as I've said, sometimes with very serious reversals, as our colleague from Uganda has said, but I believe the world now is very focused on the issue of equitably sharing resources as we respond to public health emergencies. And we very much hope that this will be the case to benefit African countries now that this additional attention is being paid to monkeypox at the global level.
Thank you, Dr. Moeti. Dr. Salam, if you want to weigh in on the Africa's emergency declaration, please go ahead.
Just a very short one. A regional public health emergency of concern declaration aimed to autonomize Africa, to make us more dependent on others. I think it is a good aim, but also it comes with risk. One of the risks that we all understand is that if Africa declares its own emergency of international concern, it may trigger a series of restrictions that may be restriction of travelers, restriction in trade. It may also isolate Africa more. It happened in the Omicron, as we know, South Africa and Botswana, in good faith, declared the Omicron, and it had some impact. It needed some leaders in Africa to speak out, like Dr. Moeti, other leaders, and that restriction was limited and later lifted. So it may be good to think about that consequence. Another consequence that may happen is that there is a whole process for the world in the international health regulation where the Director General of WHO can declare a public health emergency of international concern. If it is not done by the same organization, we can have there a confusion in semantic and in action that may delay the countermeasure. The people and those who are providing those measures may be confused of which one is different and what are the commonality between those declarations. Whenever it is happening, I believe that WHO is very open to discuss and see the best way to settle this issue. Over.
Thank you, Dr. Salam. And Dr. Peter, do you want to weigh in on the monkeypox vaccine research? Dr. Peter, are you there?
Yes, thanks. No, I think just as the question was, I think it's a fair question about why it's like the world coming to terms with this now. I think here in DRC, this disease was recognized in 1970, and the world is just learning more about it now because of the global outbreak. I think we should know by now that a disease anywhere can be a disease everywhere. And with the studies like the one we did in DRC, I think the study team, those results will be evaluated with the study team and the Ministry of Health in August or September. And I think once the results, the efficacy is demonstrated, I think that will become another tool that can be made available for the rest of the continent for use. And I think here it will just be using the different delivery methods that we have in our health system to make this vaccine available to prevent further spread of the disease. So we are hopeful. Hopefully, after the results, that this will become another tool, and as the director was saying, it will be quickly made available to the different ministries and different countries, especially those that are severely impacted by the disease. Over.
Thank you very much for that addition, Dr. Peter. We have the next question. It's coming to you, Dr. Moeti. This question is from Dicta Asimwe from Uganda. What prior intervention, if any, could have stopped the spread of monkeypox? Would researching emerging infectious diseases have helped? Dr. Moeti, let's start with you.
Yes, thank you very much. I think with this fast evolving outbreak that is spreading mainly in Western countries, I believe this came in a totally unexpected way. And the way that it has been tracked among a particular group of men who have sex with men in a particular context of gatherings where, what's going on in the north, I might say, in Western countries with the summer evolving festivals and social gatherings of various types where people congregated and were close together and some was sexual contact. I think my view is that it would have been very difficult to anticipate this. And what I observe is that there has been a very swift response, first in tracking, in doing the work to do the epidemiology, and then in taking other actions in order to contain this outbreak. And luckily, as we said, we are hoping this will also benefit our countries in the African region. So we need a better understanding of how this has happened to anticipate next. So what do you need to do when people are traveling internationally, when people are gathering, in order to ensure that outbreaks that are very unexpected do not happen as this one has happened? So perhaps it is really reinforcing in those types of contexts the basic measures of preventing diseases of all types from spreading. But one would need to then balance that against what would be normal activities in the type of context where this happened. I believe it would have been quite difficult to anticipate and prevent this, but perhaps it teaches us that we need to remind people when they are going into certain situations to take all the precautions that are needed to minimize transmission of infection in general. But I do believe that the response has been very swift. And so we are hopeful that there will be further work done so which will bring under control this outbreak and spill over and support some of the work that's been going on in Africa to strengthen our response in relation to monkeypox and preparedness on the continent as well.
Thank you, Dr. Moeti. Professor Emmanuel, do you want to add on this question? Professor Emmanuel?
Oui, tout à fait. Tout à fait. Ce que je peux dire, c'est que on a observé avec dans les années 1970, le premier cas qui était intervenu, c'était à la suite de l'éradication de la variole. Dès qu'on a arrêté la vaccination contre la variole, on a commencé à avoir émergé des cas de variole de singe. Ça veut dire que c'est un virus qui circulait, mais qui était couvert par la vaccination contre la variole, puisque c'est des virus de la même famille et qui ont des réactions croisées. Donc, ce qu'on aurait pu faire pour anticiper, pour empêcher justement cette propagation, c'est que c'est quand même un problème de santé publique en Afrique. Et si on avait anticipé et on avait développé des vaccins qui permettaient de protéger la population centrafricaine, on aurait limité la propagation, parce que si on voit bien, les premiers cas survenus en Occident ont été des cas d'importation. Donc, l'action qu'on aurait pu faire, c'était vraiment de développer des vaccins et essayer de maîtriser, de contenir cette maladie. Malheureusement, aujourd'hui, c'est survenu et je pense que c'est encore une fois de plus des leçons que nous apprenons. C'est que quand de nouvelles maladies interviennent dans un environnement, peu importe où ça survient, c'est très important qu'au niveau de la communauté scientifique, des efforts soient mobilisés pour pouvoir apporter des solutions nécessaires et empêcher que cette maladie finisse par s'installer et se propager à travers le monde. C'est ce que je peux ajouter.
Merci beaucoup, Professor Emmanuel. And finally to you, Dr. Peter, if you have any addition on this question.
I think maybe what I probably want to emphasize is, in addition to the medical countermeasures like treatment and vaccination, I think we should really strengthen preparedness, surveillance, laboratories, so that this really helps us in early detection and also infection prevention control, especially for those healthcare workers, so that if we have these cases in these facilities, it limits propagation of this virus. So really, preparedness is something that we should really kind of like really emphasize. Surveillance, laboratory, infection prevention, all these traditional pillars of preparedness, I think will help really limit an early detection of that to limit the propagation of the virus. That's what I would probably want to emphasize. Yeah.
Thank you very much, Dr. Peter. Yes, preparedness is very important, not just for monkeypox, but all infectious diseases as we deal with outbreaks on the continent. This next question is coming to you, Dr. Tiano Baude. The question is from Declan Welsh from the New York Times. Have the BF4 and BF5 subvariants spread much further than South Africa? Dr. Baude, please.
Thank you very much, Dr. Murray. Yes, indeed. I mean, over the past 3 months, we have seen, a circulation of these new sublineages, the BA4 and BA5 outside of South Africa. And more recently, it's a country like the DRC where most of the cases of these sublineages which has been reported. And we know this is definitely through the connection which exists between South Africa and DRC, especially with the mining, activities related to minings. But what also we can say, Dr. Moeti was mentioning kind of this low level of increasing number of cases in some of the countries of the region. We might suspect that, this is a subsequent of the circulation of these new lineages, in other countries, notably in East Africa, but also in West Africa. And the work that we are currently doing on the genomic sequencing in all of these different parts of the region here, are really quite in favor of the circulation of the BA4. We have been in interaction with our partners like the regional laboratories, like the Institut Pasteur of Dakar, for trying really to identify more specifically, the intensity of the circulation of these new sublineages. But overall, what we can say, yes, the BA4 and the BA5 is circulating in our region here, and that this might be one of the explanation of the movement of and the slow increasing number of cases in some of the countries. Thank you. But maybe just to conclude, we are also definitely monitoring also the hospitalization, rate due to those cases, and at the moment, at least, we are seeing a kind of certain level of stability in the level of in the level of hospitalization in most of the countries affected by this increasing number of cases. Thank you, and back to you, Mary.
Thank you very much, Dr. Tiano Baldi. This next question is coming to you, Dr. Salam. The question is from Rhoda from the BBC. The BBC is in possession of a document from WHO that urges health ministers to reject a proposed amendment in the Africa CDC statutes that will give it power to declare emergencies on the continent. Why is WHO against this amendment? And the second part of the question is, what would be the implication should the health body make such a declaration, given that there are provisions under the international health regulations? Dr. Salam?
Thank you very much for this question. In my understanding, he asked that they have a document that was circulated by WHO to health minister, urging them to not accept the declaration. There is a document that was published yesterday by his colleague from DIVEX. That document, first to say that it reflects the WHO Africa region position on the issue. But I should say also that document was not circulated to Vice Minister of Health in Africa. It was one country, one WHO official who summarized his view and give it to his authority, Minister of Health. So it was not a document circulated to all ministers of health. Now, related to the content of the question, declaration of public health emergency of international concern, why it is a problem while it is already in the international health regulation. I think I'm just gonna take the question in another way, saying that why create it if it is already in the international health regulation? And in the international health regulation, a public health emergency of international concern is something global, as we know that the viruses do not have borders and we can't fence against a virus. It is better to consider it as a global issue. And in the international health regulation, the Director General of WHO has the capacity to declare such a public health emergency of international concern. It has been declared 7 times since its creation. And each time it triggered solidarity, international solidarity, and a stronger response. But also we should say that when it is not declared, we see the case for over 1,000 cases during the period public health emergency of international concern exists. Responses exist. WHO is recording over 100 emergencies in Africa per year. And for each of them, when the country make a request, there is responses that exist. So this declaration of regional emergency of international concern is a good discussion, interesting, that we should all participate and also see what are the interests of the African population on that. If the interests are to save life and reduce pain, we're gonna be subscribing on it and make it happen and support it as much as it should be. But it needs reflection, it needs to provide data and fact and before to declare it. Emotions are good to encourage that, but data and fact also are very good. Over to you.
Thank you very much, Dr. Salam, for that elaborate response on Rhoda's question. The next question is coming to you, Dr. Moeti. This question is from Ali Ponje from Times Group in Malawi. It appears that most African countries do not have strong surveillance systems at the points of entry. For instance, the case of Malawi, the peak of COVID-19 pandemic, majority of cases were imported. Then after 30 years of eradicating polio in Malawi, a case was also imported. Then now with monkeypox looking around, there are fears that it may be imported into the country. How do you think Malawi can avoid such cases where cases are imported from countries that are endemic? Long question. Can I take it again?
No, it's fine. That's fine. I understood. I mean, I think that it's true that from the assessments that have been carried out around the international health regulations in the last couple of years, WHO and member states in Africa now have a very good idea of the strengths and the gaps and challenges of their systems as far as these capacities are concerned, including surveillance systems. And indeed, we've noted that there is need to invest more and to strengthen the surveillance systems in many of our countries. And this work is ongoing. Having a strong surveillance system will not prevent the importation of cases. What it will do is enable the early and rapid identification or detection of these cases, and therefore hopefully trigger action to contain whatever disease spreading and stop large outbreaks happening. So the justification, indeed, the very important justification for investing in surveillance systems, for investing in health systems that have good surveillance components, is that the way life is today, we travel, people travel, the connectedness of the world is incredible. So from neighboring countries, from faraway countries, as probably happened with the wild polio virus case in Malawi, which is connected genetically to a case that's circulating in Pakistan. And this emphasizes the importance then of investing in strong surveillance systems, because the idea is to find the disease that might spread very quickly and to take action to contain it and to stop the outbreak. So that just, I think, just underlines that importance in investing in preparedness, in strong systems. And this is something that we as WHO are promoting and supporting very actively indeed in all our member states.
Thank you very much, Dr. Moeti. Dr. Daniel, do you want to add on this question from Malawi?
I think we also, in terms of polio, had an experience before we did our national coverage vaccination. But yes, as Director Moeti has stated, yes, we do have a lot of movements, and those predispose us to other emergencies that we need to look out for. I think that's all I had to add, but not significantly more than what she's already said.
Thank you very much, Dr. Daniel. And this question is coming to you, Dr. Fiona Bracker. I noticed that Sierra Leone was listed among the 7 countries that reported monkeypox in this ongoing outbreak. But the Ministry of Health has denied that it ever recorded any case. I would like to know how you reached this conclusion. Dr. Bracker, please.
Thank you for that question. We do receive notification of suspect cases that come through the integrated disease surveillance and response system that's in the countries. Monkeypox is a notifiable disease through that system. However, these are suspect cases and they need to be confirmed by laboratory testing, PCR test. We have seen in the last weeks that with the increasing awareness and surveillance for monkeypox, more countries are starting to report suspect cases, but these would need to be confirmed. So in the case of Sierra Leone, we do not yet have notification of confirmation of an outbreak.
Thank you very much, Dr. Fiona, for making that clarification. And we are coming to the end of this press briefing. So I will turn back to our panelists for their final thoughts I will start with Dr. Peter.
Thank you, Mary. I think I would say this has really been enriching. I think we've seen that there is research, what research can do, like in the case of DRC, the vaccine that was done here is still underfunded. So that's something that I think countries should invest on, as well as we talked about preparedness and response, so that we are prepared in better early detection and response to this. And I think here having key public health, national institutions that can coordinate that response role, I think will be helpful. That way, I mean, as we are hearing, I think it's good to be prepared for this, because you really can't stop it at the shore if people are already coming in, be it through any of the ports of entries, by land, by sea. I think you have all those surveillance methods at these ports of entries for early detection and response, and to also invest in additional research for vaccines as well as for medications. Yeah. And public awareness, reinforce public awareness to this disease. That's what I would like to contribute now. Thank you.
Merci beaucoup, Dr. Peter. And I go to Professor Emmanuel. Your final thoughts, sir.
Oui, merci beaucoup. Moi, je pense que cette discussion me donne un sentiment de satisfaction de voir tout ce qui se passe, tout ce qui se fait déjà dans la zone afro. C'est vrai qu'on n'a pas abordé un certain nombre de domaines, par exemple en termes de prévention. Je sais que au Nigeria, en République centrafricaine et dans certains pays, il y a beaucoup de travaux de recherche qui sont faits, soit au niveau de la connaissance de l'écologie du virus, les facteurs d'émergence, tout ça, ce sont des choses qui se font sur le continent africain. Si on associe cela déjà aux essais de vaccination, ça veut dire que nous sommes vraiment en avance sur les efforts qui sont faits sur la connaissance et la maîtrise, ainsi que le contrôle de cette maladie. Si nous pouvons travailler, renforcer notre synergie et travailler ensemble, je pense que nous pouvons aussi, comme disait mon collègue tout à l'heure, développer la capacité de production de vaccins sur le continent africain, ce qui se fait déjà pour l'exemple, par exemple, du coronavirus en Afrique du Sud. À Dakar, ils ont la capacité de production de vaccins. Je pense que de plus en plus, l'Afrique commence à montrer des exemples qui aujourd'hui peuvent être transportés de l'autre côté de l'Occident. Et pour moi, c'est vraiment une fierté pour les chercheurs africains. Merci.
Merci beaucoup, Professor Emmanuel. And to you, Dr. Daniel.
Thank you very much, Mary, and thank you, Director Monkeypox, for having this kind of conversation. I think we need a lot of engagement with our community so that we push back on the negative information around vaccination. I think that is our biggest challenge at the moment.
Thank you very much, Dr. Daniel. And finally to you, Dr. Monkeypox.
Okay, thank you very much, Mary. And I'd like to very much thank my fellow panelists. Thank you so much for your valuable contributions to what has been a very informative discussion. And thank you and congratulations for the work that you are doing. For me, it's been a very exciting opportunity to find out in some detail about some research that's being carried out on the continent and some of the capacities that we have in our countries. So that's been extremely informative. And I think just to summarize, building on the concluding statements from some of my colleagues, there certainly is a certain dynamic on the continent. It has been triggered by the COVID-19 pandemic, which has been a very difficult experience for the whole world and for Africa. And I echo the sentiments you've expressed that we need to take this forward so that we see how further investments in vaccine research or research overall, and I echo very much the call for more investment in research in Africa by African governments, and also continuing by our partners in investing further in preparedness, which we are working very hard on in WHO now, actually in partnership with the Africa CDC, to increase the capacity in our countries, institutional capacity as well as the human capacity, and to reinforce synergy, as was said by one of the colleagues. Engagement with communities is important for everything, for COVID-19 vaccine acceptance, and also for improving our surveillance systems, because disease outbreaks start at the community level. And it is when people start to see something odd happening among themselves and report it or take themselves to the health facility that we can very early on improve our surveillance systems. And if we make them aware of the role that they can play, we can really improve our systems. And then finally, very much the idea of working together, reinforcing synergy, working in partnerships between researchers, governments, institutions like WHO, and our strongly emerging public health institution on the African continent, the Africa CDC. I think we can only celebrate the strong reaction in Africa, and we as WHO are very, very ready to engage on it and build together the capacities, the processes, so that our governments, our ministers of health feel themselves empowered to take decisions and to take actions that contain these diseases and build our capacities. Thank you very much.
Merci beaucoup, Dr. Moeti. We have now come to the end of the media briefing for today. I would like to thank our excellent panelists, the journalists, our experts, interpreters, and everyone for joining us today. Do have a nice day. Thank you and bye.